So I'm going to walk you through the basic components of the annual wellness visit documentation. Now the screen is going to look different of how you pull your patient up, but here we have a test patient. The name is Bo, and you'll see here there is an appointment, and the status is that the patient has already arrived and checked in. And so I'm going to double click on this patient to open an encounter and start this annual wellness visit 2. And that is what they are labeling the subsequent annual wellness visits in Epic. So to start this visit, you're going to click on the Rooming tab on the left-hand side of the screen. And basically you're just going to go from top to bottom and complete as much information as you need to. Remember, clicking on the pencil icon will open up that section for you to document. With visit information, with the reason for visit, if you type in annual, you will not get what you want. Let's try Medicare. If you type in Medicare, you will see that the Medicare annual wellness visit subsequent is an option. So select that. If you right-click that selection, you can go ahead and add that to your speed button, and then from now on, that will be an option that you can just click automatically without having to type it up. As you scroll down or select next, it'll take you to the next section. Use your pencil to open up vital signs. Smoking status has never been assessed, so you can either jump to the history or close that out. I'm going to choose to close it out because I want to stick going from top to bottom, and we'll come up to the smoking history a little bit later. So enter all of your vital signs. When you get to pounds, remember that you have to actually specify that it is pounds or kilos. Oops. When you get to tobacco, I would go ahead and skip this section because there's a much more detailed tobacco use section later on in your assessment. You'll get to allergies, and here this patient already has one noted, and it is sulfa. You can mark as reviewed and go on to next. If there were additional allergies you needed to add, you would do that here. If the patient has any pharmacy benefits, that would happen in check-in and registration, and that would pop up here. This patient has no medications on file. If you needed to add any, you would add that here by clicking the pencil icon and adding the medications. But for purpose of this demonstration, and to speed this up, we're going to say the patient is not on any. With history, you can simply go through, click yes on any of the things this patient may have. Oh, sorry. I'll use this. Oh, that didn't even help any better, did it? Okay, let's go back to where I was. Medical history. Then with surgical history, you can click what the patient may have had there. Then you get to family history. This is also a requirement, making sure you know what their family has had. If you right click on that box, you can give a little bit more detail. So complete that as much as you can. Here in social history is when we get to a little bit more detail questions about the tobacco use. So So make sure you fill this out. This is a requirement in the annual wellness visit. We'll say this person was a former smoker, and he says that he started way back his date of birth is 73. So we'll say he started in 84. And he quit in 09. He smoked cigarettes. He was 1 pack a day. No, you did not give any counseling. And he has never used smokeless tobacco. He does not use alcohol, and he declines using any drugs. If he asked any sexual activity questions, you could also enter any social documentation. They definitely would like to see some patient goals entered at this visit. So let's say this patient wants to work on diet. Simply type diet, see all of the ones that can come up as options. Let's say this patient wants to just eat 3 meals a day. It's a patient stated goal. You can get a little bit more detailed if you wanted to, or you can simply say accept. Press next. The travel and exposure screening should be asked at the time of check-in, so you should be able to skip that. The SBIRT question, go through these, and you'll want to start asking all of these questions to the patient. You'll see at the top, now that we're in screenings, all of the screenings show up at the top. So you can jump across the top as well. But as you move along, they'll go through there. We're going to make this patient pretty simple for the demonstration purpose. And as you noticed, by selecting 0 and 1, it auto-populated a score that then wants us to continue asking questions. So then you'll answer those, and I'll give you your score. So you'll continue asking these as you go along. And this is why I see these visits take you guys forever. And this I do want to ask you guys about. I'm not sure exactly how you're doing the vision screenings in the clinics. But here, let's just say they have 30/30 vision. The section on gender identity and sexuality is actually really important to fill out on all of your patients. And the reason why is that this will autofill with default responses in our text for our note that I'm going to show you here in a little bit. So you can, if you want, you can identify their patient's sexual orientation. But what's really important is this male or female. So Bo is telling us that he does associate as male, and you'll see that that selected he, him, and his. And then it goes through. And selecting next. So we're now done with our screenings, which also means we have completed our rooming tab. So we're going to now select the care management section. Again, we're going to go top to bottom. and then left to right. So you select your pencil. You'll ask the patient some information about their living conditions. So this assessment was completed with just, say, the patient. Are they enrolled in a care management program? Now, this question I have escalated to the executive team in population health to really find out what is the definition of a care management program. So stay tuned as to whether or not we're collecting yes or no on these. But what is their living situation? What is their support system? Do they have family conflict? Where do they live? Are they able to afford rent or utilities? Do they have home care services? Do they have equipment used at home? Do they need a communication device? And so on and so on. So you will go ahead and answer these questions as you go on. So just continue going through the questions. Unfortunately, there's another expert screening that will pop up, and then you'll notice there's also another PHQ-9, but since you've already answered them, the answers are auto-populating, so you can just scroll past that. For patients that have certain diagnoses, in this care management section, other questionnaires will populate. So if this patient has a diagnosis of congestive heart failure, there will be a congestive heart failure questionnaire that will populate that you can choose to select and start asking certain questions. But this is not required, so we're going to skip that for the time being. We're now going to jump over, since that's the end of that section, and we're going to go to the right side of the screen. And since I want to see this section a little better, I'm going to move this over. So we have some best practice advisories that are going to pop up and give us some recommendations for this patient. So here it's telling us that this patient has had no influenza vaccine administered and documented. So do we want to complete the recommended SMART set? So we would say, yes, let's open our SMART set. Oh, then you click accept. So it's going to open up that SMART set for us. And unfortunately, you kind of have to keep moving this over. So we're going to have the general influenza vaccine. We're also going to do the adult male prevention interventions and open those. So we'll go down. You'll pick which dose it is that you want to administer. What is the dose? 0.5. When you have the hourglass or magnifying glass, you can search for it. And I'm not sure why it's asking for a dispense and refill, since we're not going to really dispense that. What kind of options does it give us? Maybe we can just put it in again. See, you learn something new every time. I haven't seen these options show up before, so it's normal. We're going to keep scrolling down. here's all the different things we could order for this patient, and they're recommending Hep C screening, PSA screening, colon cancer screening, all of those things. And so it's here in the Smart Set as recommendations for this patient. You'll get down after the orders to the patient's problem list. So you'll go through, you'll want to mark those as reviewed. And as you know, we need to comment on all of these, and I will show you here in just a second where we're going to do that. Again, the patient goals show up. So then an important step is to go down to your More option, and you're going to need to select the option of flow sheets. There's a few questions that are hidden in this Medicare AWV section. And these top 10 or so questions that are about emotions in the last few weeks are ones that we have to answer because they get pulled over into our annual wellness visit template. So the nice thing is it's pretty easy to just click the answers and move through. There are questions at the bottom, and they're pretty good questions to ask, but unfortunately these don't auto-populate anywhere into the note. So if you would like to ask these questions, that's great, and they will be in the patient's chart. But again, because this is taking some time, I'm going to go ahead and skip that for the time being. So after you finish flow sheets, I'd recommend selecting the wrap-up section. Here's where you can enter patient instructions. And since this patient wanted to learn about having a more balanced diet, let's see if there's any good instructions on diet. And let's just pick something easy. Well, I know he doesn't want a gluten-free diet, but let's just pick one to have it populate. Before we finish and do our care management smart form, if you'll see way over here on the right hand side, there's a little arrow where we can expand this side of our screen. And this is where we're going to generate our note. So when you click notes, you'll go to this insert smart text. And if you type in annual, you will not see. There should be a Medicare annual wellness visit subsequent. Oh, okay, so again, type in Medicare like we did earlier, and it's the Medicare subsequent visit template. Click accept. Let's go ahead and move it over. And what will happen is, remember that gender identity section, and we identified that Bo identifies himself as male? That is where this information is getting pulled from. And throughout the note, it's going to auto-populate male. It may say sections where it says his. And so that's where that information is really important. But we're just now going to work top to bottom. So current concerns, anytime you see these three little asterisks, you're going to place your cursor and you are going to free text. So this patient, his current concerns are related to diet. Now this is a very simple note, so I would make, I already expect you guys to have much more elaborate notes, but again, this is just for purpose of showing you. If you press F2, that will take you to the next section. But unfortunately, I'm on a Mac, and look what happened. That did not help, did it? Oh, okay. I'm going to have to just scroll down. When you get to the next section under discussion and plan, this is where all of the active problems are going to be listed, and you're going to be able to place your cursor and type. And this is where the coders are going to be able to pull all of our HCC codes. The really nice thing is is the codes that are actual HCC codes are going to be identified and labeled for you. So while it's still good to document all of them and still capture all of the codes, the ones that are most important for these annual wellness visits are the ones that say HCC codes. So for purpose of this demonstration, let's just say patient reports condition is well under control, no changes. Same thing with congestive heart failure. Patient reports condition is well controlled, no changes at this time. How about for this one, we can say patient is verbalizing some concern about increased symptoms of depression. We'll pass on to PCP and make patient a follow-up appointment to return and discuss these issues with the PCP. We'll also bring in behavioral health for immediate assistance. I don't know if that's something you can actually do, but it sounded good. You'll then move on to the health risk assessment. And as you move through these, it's going to ask you questions. And unfortunately, this is a real pain. I don't know if I'm going to be able to do this now that I'm this far into it. Darn it. Oh, no. Okay, so, see, look at this. Okay, health risk assessment. In the flow sheet section, when there were those 10 questions we answered, this is auto-generating those answers. So, there's nothing we need to do here. ADLs. Somewhere I missed showing you that. But this is where that data will auto-populate over. The depression screening score. The problem list will auto-populate here. This is where you don't need to do anything. It's just pure documentation. All of the history is going to show up. Anywhere that is yellow is somewhere that you need to document. So this is where I may not be able to do it because I don't have the ability. There we go. You'll be able to right-click your mouse and answer the question. So here it's saying, are you currently working, yes or no? So you can say yes, no, or retired. So we'll say yes, this patient is working. They are working 35 to 40 hours per week at Fred Meyer. Accept. So that's how that looks. So you'll continue on, you'll go through everything, and like I said, when you're on a regular computer, if you press F2, it'll just take you through every single section that requires your attention. You'll notice that the current list of providers will automatically populate, and this will be based upon the care team that is already listed in the patient's chart. Any immunizations will auto-populate. The preventive care and screening that is generated based on the patient's age and health records, and everything that is in that best practice advisory will come from there. A review of symptoms is something that you can enter right in here. The vital signs will carry over. The vision screening. Here's where you'll answer questions about the mini cog. And you'll go on and on and on. So at the end here, there will be one question about the advanced care planning. If the physician wants to pop in and do anything about the advanced care planning, I would answer this question and then make an annotation saying the physician was present, and then they are going to have to make their own separate note about the care planning and submit that for coding and billing purposes. So once you're done with this entire note, you'll click accept. You can select this green arrow, and you'll notice it's pointing to the right, so it'll send that note back over. You'll be able to then say how much time it took you to do this visit, which I'm going to say an hour, but my gosh, it probably felt like 3. Oops. So we'll say 60. And you spent 20 minutes reviewing the chart beforehand. And as you just continue scrolling down, if you needed to make any follow-up appointments, let's say this patient does need to come back in 1 week for a recheck for depression, that will trigger the front desk staff when the patient checks out. Here's our code. You'll need to put in the provider. And then the code capture is your annual visit code again. Oh goodness. And if I could type, that would be helpful. Oh, maybe I don't put that in here. All right, well, let's just try not to. All right, so when you're done, click Sign Visit. And if you miss anything, like here I go, it's going to tell you what you need to do. So apparently I have no diagnosis for this counter. So let's say this patient had depression, and you're going to need to enter specifics. He had congestive heart failure. We'll just say those two. Let's see, what was the other things I left out? The following user has progress notes with unfinished variables. So since I just skimmed through that note, it's not going to allow me to do that. And there are medications that are unsigned, pending, or not. So we need to associate these orders. So every order has to be associated with a diagnosis. And really, this dose or this medication doesn't really fit with any of those. So you can type in an annual physical exam. Let's associate with that one. Let's see if that helped. Still not. Well, when you finish everything, you will just be able to sign the visit and you'll be done. The one thing we are still trying to work out as well is how we are going to now send this note over to the physician for co-signature. So stay tuned for that. But hopefully that will help just give you a little bit more visualization and walkthrough from start to finish on how the annual wellness visit documentation occurs. Let me know if you have any questions.